I started for the first 6 years of my practice. We do about between 12 and 1,400 ablations a year. And I started the first 6 years of practice using Dornier 940 and 1470 lasers. And I thought it was amazing. I loved it. We really thought it was ideal. But, you know, typical cardiac surgeon's personality, they're frequently wrong, but never in doubt. I was wrong. And I didn't even realize I was wrong. When a guy came in and said, yeah, I mean, your results are excellent. Patients are happy, but you got a lot of bruising. Why don't you try a different catheter? He knew I was reluctant to use the other RF brand. I just thought that there was a very stiff catheter, and I thought that that brand had longer operative time, and I just really was reluctant to use it. So that's when I was introduced to Venclose, and we did our first 5 or 10 cases, and literally I've never brought the laser out again. We initially thought that all the patients that we had already been pre-approved for laser, we'll just do those as laser, and we will start with our radio frequency on the new batch. But we were so enthralled by the radio frequency that we literally went back to the insurance companies and had all of our procedures recoded to allow for RF. And there's a lot of reasons, in my opinion, for this. The first are patient concerns. Number one, they don't have a bad taste in their mouth. I think the laser users out there would agree that every patient, or 90+% says they have a putrid taste, a metallic taste, a broccoli taste in their mouth, and it's not enjoyable. So that's the first thing. The second thing is you would go from a 35, 45, in some cases even longer introducer sheath to a 6 or 7 centimeter introducer sheath. The introduction of the sheath is seamless, and I use that little tumescent trick in the wire. You don't feel that at all versus a very, very long sheath going in, so the patient's more comfortable there. The laser, in my opinion, emits photons. The photons are emitted radially. You get radial microperforation of the vessel. It's a starburst, sunburst type of dispersion of the energy. And when that happens, you get microperforations along the entire vein as you pull it back. As a result, you also get, in a lot of cases, bruising and ecchymosis. We don't get that hardly ever with radio frequency, hardly ever. Also importantly is that the burn with, at least in my hands, I know I'm from New Orleans, but I don't have any rhythm, pulling the catheter back at 1 centimeter per second, it's never really that consistent. And I know there's some catheter pullers out there. I've never used one, but the advantage to me when I went to radio frequency is that it's a metered 10 centimeter segment or 2.5 millimeter centimeter segment, and that meter is 20 seconds, and you can't mess up your timing, and the burns are much more consistent. Your residual focal patencies, segmental patencies after the procedure are much less, and your recanalizations are almost none. For the provider, for the operator, it's a new world. With the laser, in my opinion, it was very stiff. If you advance it at all, especially when the tip's hot, you're sure going to perforate. Whereas the steerability that Dr. Hamilton was discussing before has made this that there's almost no veins that you can circumvent, or there's almost no tortuosity that you can't traverse. It's really a beautifully designed device. The tip is the exact right amount of flexibility to it, so it really does just kind of gingerly bounce off walls, and it's really patient friendly. Overall, the reason I switched so quickly is patient satisfaction. None of them went home and elevated for 24 hours. None of them came back requiring 2 weeks of ibuprofen. None of them came back bruised. They literally leave my office and still do and go to the fence court. And they tell their friends, I just had an ablation procedure, and then the next day their friends here. Rather than saying to their friends, I was in bed for 24 hours, I was miserable, my whole leg was bruised, and for 2 weeks I was on ibuprofen. And as a result of that single switch, my practice exploded. It exploded as far as patients. because their perception of the procedure, their perception of recovery entirely changed. So for me, those are the reasons in a nutshell why I switched from laser to radio frequency.